Hello everyone, my name is Dr. Christopher Vogelman. I'm a practicing chiropractor here in Rockville, Maryland, with offices also in Alexandria, Virginia. Today I'd like to speak to you a little bit on the topic of neck pain. Many of you out there suffer from neck pain. I know I have from time to time. We tend to have very, very long commutes in the Washington, D.C. area, and our heads sometimes lean forward over the steering wheel, or when we're at the office we find that we may have poor posture leaning forward into the computer to look at our various types of work. Now, neck pain has a number of different causes. Chief among those are trauma. Perhaps you had an accident in the past, a whiplash, or some seemingly minor auto injury, and didn't think much of it. Or perhaps as a child you fell off your bicycle, or you fell out of a treehouse, or hit your head at the bottom of a pool, and were able to shake it off because it really didn't seem that serious. Well, many years later, in fact decades later, you may be feeling the effect of these past traumas. And these can be centered around your neck and shoulders. Now if you think about the head basically is a 10 to 14 pound bowling ball. And your neck is very much like a slinky. You have a lot of flexibility, but not a whole lot of stability. And it's your muscles that provide that stability. And muscles over time can stretch out and contribute to poor posture. So perhaps you're at a keyboard all day long and you're chained to your desk for maybe 3 to 4 hours at a time. Well, that strain of the head pulling forward and the consequent stretching of the muscles over time may cause your muscles to behave in an abnormal manner and no longer provide the support that you need to your neck. Now, the neck is very important because it provides a protection for your spinal cord, and it also provides an exit for all of the nerves from your cervical spine, which go to supply your arms, your shoulders, and many of your internal organs. So it's very, very important to have this checked out. Now, what can these misalignments do? Well, if you think of my finger as a nerve, and you think of this rubber band as a misalignment, which is choking or cutting off circulation to the nerve from your neck into your arms, or even into your face and other areas, you can see as this changes to a lovely shade of purple that there is an interference, in this case, in circulation to the finger. And in the case of your spine, there is an interference in the normal nerve flow from the brain through the spinal cord and down, in this case, to the bones of your neck, which can cause dysfunction or weakness, or can even cause a strange feeling like numbness and tingling down the arms or hands. And of course, if I take off this rubber band, which is symbolic of that misalignment, you can see that over time the circulation is restored to normal, and thank goodness the color comes back to normal in my finger. And so it is too with your spine and with all of the various parts of your body that are affected by the cervical spine. For example, if you have numbness down your arms, it could be because of a pinching of a nerve or a choking of a nerve, which can be relieved through gentle manipulations of the cervical spine, sometimes with as little force as 4 to 8 ounces of pressure. I'm able to, as a chiropractor, diagnose what's wrong with you with using 7 very simple tests in a very short period of time. We supplement that with X-rays if necessary, or MRIs, and I'm very well schooled in neurology, radiology, and orthopedics to be able to recognize the problems I can treat and those I need to refer out to another provider. But many of our patients come to us after having exhausted all of the medical solutions with respect to their neck pain. They've tried the ibuprofen and the Aleve and a lot of other medications. They've tried physical therapy, but still have neck pains that may be radiating down to their arms. The cervical spine can also result in such things as headaches, but we'll discuss that in a later video. So if this is something that you might want to explore, or you find this interesting, or just want to send me some comments, please feel free to do so. You can reach me at my Rockville office at area code 301-881-1110. Once again, that's 301-881-1110. Or you can reach me at the Alexandria office at 703-619-1002. Finally, you can reach me on my website, which is drvogelman.com. That's drvogelman.com. Thank you so much for listening, and I look forward to hearing from you. Goodbye.